Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today are the basics of sciatica. What is sciatica? It occurs when one of the nerve roots of the sciatic nerve is pinched. The sciatic nerve is actually a confluence of these three nerve roots, L4, L5, and S1. See how they come together and form the sciatic nerve that then goes down the back of the leg. 1 to 2% of the population suffers from sciatica symptoms at any one point in time. The most common reasons it occurs are either from a herniated disc that has squeezed out and is pushing on a nerve root and causing sciatica, or from spinal stenosis, which occurs from degenerative arthritis, from overgrowth of bone and soft tissue that can pinch on one or multiple nerve roots. There are some less common reasons. If a person has degenerative disc disease, the irritation of the outer part of the disc can envelop the adjacent nerve root. A tumor could be pinching on a nerve, and then a problem of the nerve roots after the nerve root, like a peripheral nerve. How does it occur? When a disc degenerates, the outer layer may tear and part of the inner jelly can squeeze out. So here's a disc. Normally it's contained just fine. If it starts to bulge or you get a tear here and part of the inner part squeezes out, it can pinch this nerve root, and it's red here to show that that can spark up inflammation. Okay, it's the inflammation that causes the nerve root to be irritated and sciatica to occur. This is why a disc degeneration without herniation can still lead to sciatica due to the inflammation. So think about it. This is getting pushed on here. That in and of itself is not painful. It's the inflammation that gets sparked up. So even if this was back here and there was a tear that was causing inflammation, and that inflammation chemically enveloped this area, it can cause pain. What are the symptoms? Well, they're going to vary between patients. Not everybody walks right out of a textbook. You might have some burning or an electrical sensation in your leg, pins and needles, some numbness. Then it can lead to motor weakness, where, for instance, if it's L5, you have trouble lifting up your foot. And then rarely you can get incontinence. That's actually a surgical emergency. Well, how is it diagnosed? The most common way it's diagnosed is a simple history and physical. The doctor will listen to the patient's symptoms and then do an exam where they lift up the leg, such as this, which is called a straight leg raise test, and usually that sparks up the pain big time. And then when they bend the knee and take traction off the nerve root, the pain goes away. Okay? An MRI, such as you see here, with a large disc herniation, pinching on one of the nerve roots, is indicative. And then if there's still questions, a nerve conduction study can be helpful. And then if there's questions after that, a diagnostic injection, an epidural injection, can be very helpful too. Well, sciatica treatment, there's a lot of treatments available. Over 95% of patients are able to be treated non-operatively successfully. Limited bed rest, this has been shown to not be upwards of a week, but more like 48 hours. You can do more harm than good actually staying in bed for a week. Medications such as over-the-counter anti-inflammatories, Tylenol, muscle relaxers can be helpful. Neuropathic medications such as Neurontin or Lyrica, and opiates can be helpful in the short term for pain relief. Physical therapy and chiropractic treatment. This may include stretching, strengthening, ultrasound, electrical stimulation, spinal manipulations. TENS units, as you see here in the upper right, it's about the size of an iPod, and these come out of it, these foam pads that go on the skin. They provide slight electrical impulses that can decrease pain. Acupuncture has been shown to be helpful. Spinal decompression therapy has been a revolutionary treatment involving intermittent spinal traction, and that's been shown to help over 85% of the time. Interventional treatments may include trigger point injections, which are sub-Q injections into the muscle that can help a lot with muscle aching and spasms. And then what you see here is an epidural injection. This is where the nerve root's being pinched. You see the disc coming back, pinching on the nerve root, and it just bathes this area with soothing steroid medication to decrease pain. Outcomes with sciatica treatment, as mentioned, over 95% are treated successfully without surgery. There was a landmark 2006 study in JAMA which showed the one-year outcome between operative and non-operative patients identical. Okay, so if a person can avoid surgery for that time, the patient often gets a lot better. Indications for sciatica surgery. Actually, I'll start from the bottom here. 6 weeks of failed non-operative treatment can be an indication. That's not an absolute, that's just an elective. If a patient says they can wait longer and try and wait, that's fine. If a person has muscle weakness, it's unclear after 6 to 12 weeks if that's going to get better, even with a successful surgery. So there is a point of no return. So that's something to think about. And then cauda equina is the emergency that I mentioned where you start to have incontinence, and that needs to be taken care of immediately. It's uncommon, but it does occur. The top pain management clinics in Colorado is Colorado Pain. There are several locations in the metro Denver area, Buena Vista, and South Granby. Over 50 insurances are accepted. Both medical and interventional treatments are offered by the board-certified pain management doctors who have won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.